Assalamualaikum warahmatullahi wabarakatuh. My name is Abai Paransori and I'm from TI 47 International, and my SID number is 102012340359. Here I will tell you an explanation about design of radiation therapy problem. Here in design of radiation therapy, there is a study case. I'll read the study case first. Mary has just been diagnosed as having cancer at fairly advanced stage. Specifically, she has a large malignant tumor in the bladder area, a whole bladder lesion. Mary is to receive the most advanced medical care available to give her every possible chance to survival. This care will include extensive radiotherapy. Radiotherapy involves an external beam treatment machine to pass ionizing radiation through the patient's body, damaging both cancerous and healthy tissues. Each beam delivers more radiation to the tissue near the entry point than the tissue near the exit point. Scattler also causes some delivery of radiation to tissue outside the direct path of the beam. Because tumor cells are typically microscopically interspersed among healthy cells, the radiation dosage throughout the tumor region must be large enough to kill the malignant, which are slightly more radiosensitive, yet small enough to spare the healthy cells. The goal of design is to select the combination of beam to be used and the intensity of each one to generate the best possible dose distribution. Once the treatment has been developed, it is administered in many installments, spread over several weeks. To illustrate how the artificial variable technique deal with functional constraints in less than equal form, we will use the model of designing Mary radiation therapy. The data for design of Mary radiation therapy is: there is a table that shows area, fraction of entry dose absorbed by area or average, restrictions on total average dosage of kilorats. First, in area, there is healthy anatomy, critical tissues, tumor region, center of tumor. Besides, there is fraction of entry dose absorbed by area. The first in here in this section or in this table, the average is separated by two types of beam. The first is the beam 1 and the beam 2. In the beam 1, we got the healthy anatomy is 0.4, and for the beam 2 is 0.5. And the critical tissue, the beam 1 has 0.3 and the beam 2 has 0.1, and the two more region, the beam 1 is 0.5 and the beam 2 is 0.5 also. And the last, in the center of tumor, the beam 1 has 0.6 and the beam 2 has 0.4. So in the relaxation of total damage, total average dosage or kilorats on the healthy anatomy is minimized. So after that, in the critical tissues is bigger than equal 7 and the tumor region is equal 6 and the center of tumor is less than equal 6. Okay, next, for the data from the table can then use directly to formulate the following linear programming model, which the x1 is the dose at the entry point for beam 1 in kilorats, x2 is the dose at the entry point from beam 2 in kilorats also. Here we got z is to minimize the dose at entry point, then z is equal 0.4 x1 plus 0.5 x2. Okay, here we got the subject or the constraint is 0.3 x1 plus 0.1 x2 bigger than less than equal 7. So the constraint number 2 is 0.5 x1 plus 0.5 x2 equals 6, and the third constraint is 0.6 x1 plus 0.4 x2 bigger than equal 6. And here there is non-negative constraint is x1 x2 bigger than equal 0. So next is the how to we solve using the constraint and objective or the z. The standard form is to minimize z. Here is z equal 0.4 x1 plus 0.5 x2 plus 0 x3 and 0 x4. Subject is we gonna input the rest of the variable to the constraints, like the first is 0.3 x1 plus 0.1 x2 plus here we got the x3, we got it from the z 0 x2 before, and here then 0.3 x1 plus 0.1 x2 plus x3 equal 7. So the second constraint is 0.5 x1 plus 0.5 x2 equals 6, and the last 0.6 x1 plus 0.4 x2 plus 0 minus x4 equals 6. Okay, here the canonic form is to minimize z also equal 0.4 x1 plus 0.5 x2 plus 0 x3 plus 0 x4 plus mx5 plus mx6 x6. The constraint become 0.3x1 plus 0.1x2 plus x3 equals 7. So the second constraint is 0.5x1 plus 0.5x2 plus 0 plus x5 plus 0 equals 6. And the last constraint is 0.6 x1 plus 0.4 x2 and minus x4 plus 6 equal 6. Okay, from that subject or that constraint, we use the OBE operation. So we got the table, or here we got the C row is 0.5 minus 1.1 m. So the constant becomes 6 and Z is 12 m. The iteration 2, we got the 0.83 and the basic varies or the C row is 0.668 minus 0.83 m. So the constant is 1 and the Z is equal 4 plus m. So we back to the Z is for minimize, then the C row is must be positive. So the conclusion from the x1 is equal 12 and x2 is equal 0 and Z is equal 4.8. The conclusion here, the dose at the entry point for beam 1 is 12 kilorad and the dose for entry point beam 2 is 0 kilorad. So the entry dose absorbed by the healthy anatomy is 4.8 kilorad. Okay, thank you. I think that's all for my explanation. Sorry if any mistake. Wassalamualaikum warahmatullahi wabarakatuh.